Hi everyone, I'm glad you're here. Thank you very much for joining me today. I got to give a shout out. Someone last night, bought me 3 cups of coffee. You know who you are. Thank you so much. We really need to put more pressure on the Biden administration to close the borders. You know, we are on alert because of the high amount of terrorists that have been allowed into our country. Well, now they got another outbreak here in the United States of dengue fever. I reported, I believe, earlier this summer that it was in Florida. 2 people had contracted it, and now in the Long Beach area of California have caught it. It is spread by the female mosquito who has bitten a person infected with dengue, and then that mosquito contracts the virus and then bites another person, and so it goes on and on. A second case of dengue has been reported by the California Health Office in Long Beach. This second report comes just a week after the first report that occurred in Pasadena, California. So I wonder what area in Long Beach it was found, and what area of Pasadena did it come from? Depending on the mosquito that was infected, the type of mosquito, it could have traveled 20 miles. So, yeah. People could be infected and not even know that they're infected. They're saying that the overall risk to the public remains low. Maybe there's not a lot of mosquitoes out right now. The first person who brought in the virus is now recovered. And so far, only 2 cases have been identified. The mosquito-borne illness is carried by the Aedes type of species, which traditionally has residence in warm tropical climates such as Africa, the Middle East, Asia, Pacific Islands, the Caribbean, Puerto Rico, Central and South America, such as Colombia and Brazil. They didn't state that this was a travel-acquired dengue infection, so more likely it's someone that came into our country illegally across the border. We are taking many steps to prevent mosquito-borne infections in Long Beach. Anissa Davis, MD, health officer for the city of Long Beach, said in a news release. Outreach teams are visiting the neighborhood where the dengue was identified to provide information on mosquito bite prevention and ways to control mosquito breeding around the home. The health department staff continue to trap and test mosquitoes in nearby areas to look for infected mosquitoes that are intensifying, and they are intensifying their efforts to reduce breeding and controlling the mosquito population. Maybe it was 2 people that came in the country. I don't know. Maybe there's more. If you get dengue while pregnant, especially during the last 3 months near delivery, you can spread the infection to your baby. Dengue can have harmful effects that include death of an unborn baby, low birth weight, and premature birth. We do not have areas where dengue is breeding. It's not here in the United States. It's brought into the United States. There have been small outbreaks that have happened in Texas and Florida. I reported on those, and in Hawaii. Once the mosquito bites a person who has been infected, that mosquito becomes a carrier of the virus. The virus can't spread directly from person to person. In rare cases, dengue can lead to a more serious form of the disease called dengue hemorrhagic fever. Common signs for the symptoms of dengue fever include high fever, possibly as high as 105, pain behind the eyes and in the joints, muscles and or bones. Another name they give it is break bones, because it feels like your bones are breaking. Severe headache, rash over most of your body, mild bleeding from the nose or gums, and bruising easily. Fatigue, vomiting, and the symptoms can start anywhere from 4 days to 2 weeks after being bitten by the infected mosquito. That person would be still contagious even 2 days after the fever breaks. Even after the fever eases, other symptoms can be worse, and they may cause more severe bleeding, gastrointestinal problems like nausea, vomiting, or severe abdominal pain. They can also acquire respiratory problems like difficulty breathing, dehydration, heavy bleeding, and a rapid drop in blood pressure. Shock can follow if dengue hemorrhagic goes untreated. There is no specific treatment available for dengue fever. Mild cases are managed with lots of fluids to prevent dehydration and something for the pain. If you get so sick where you have to go to the hospital, doctors give them IVs, fluids, and electrolytes, salts, to replace those lost during vomiting or diarrhea. In advanced and extreme cases, doctors may have to do a blood transfusion. That's all they can do for you, nothing else. Yep, we need to close the borders. So what are your thoughts? Put your comments down below. Thank you very much for watching. Thank you for subscribing. Yep, be safe, be prepared, and I'll talk to you later. God bless you. Bye.